Yung snake.
Ali?
Ali yung snake.
Oy, tulik?
Oy.
Oy, ang tirakal asal ko ra, umura ala toksyor kita facilitate ma presenta ko ra me RL algos sinye.
Di.
Pero di continue ang ngarnya register play manggukta kal soal chancellor ngi mal dilugin eta continue.
Hindi ungil.
So ka farmer tera da ngarja ma yel guk sa amal update sa kita time Kim update ya selbo to merege bol mereg diungil
Hindi ungil, man di ungil din. Tiyan sure ko mi set so mi.
Mbalway say ko.
Okay, alin di ka to kita to ko.
Oy. Happy Veterans Day.
Oh yeah, that's right. I don't know. In kel ka farang ke veterans motor walk last me at the Veterans Day ma ulis me.
Yang amal block chloride test ko gi.
Guys, marang Anyway, alam na ikorgaw introduce our guest tergi tiril ngatila lende ko ng tiril mi talawa na lister nga am tiril ngatila mem introduce our guest tergi de mergo satra program gi dera ko sangay. Okay.
Kasi magkakamal na sa uli tulik ma Diaz Broadcasting atara Eco Paradise tira connected yun direct.
I see.
Tira ka Lorenz alkap singay yung DPIO nga tiang at trigal rest tamal lo ngarnya al sangrir mas me mong lada kal sibil may register gid al kap sinya ngarnya Dr. Myra Adelbai-Fraser ngarnya katok tangara insininga internist ra ministry BNH ngarnya Karol Tukana nga nurse Marciana Ngirailemesang katirek kan nurse.
Okay.
So kapsinya yel ku ka updates ra katumo ngani yel baby updates mentis yang yel ku tinga yita ku ay sete tati makasala at nga quarantine.
Okay.
Gita tapi gamen tapi gita kapsinya diabetes sel longotori basing sukal.
Okay.
Gita ampenye tudi ko mula se sukal taray gel rapt ya sukum katumo COVID-19 sa sugal taray gel rak mal sabil mal mosmera adal sabil mal adire kal saru el almen sa batong yang tomkodorik masing World Diabetes Day ang selbe kalra ngora mo sa ba mal ku korang arya ukaton malubeng gora health fair kama mandi el arraging ngora mringa kama mal mudala makrol crowd amang kitay kita toksyo awaya bol surbel ku kora all si sakra atara blue o maklat kra toel malubeng ser el sukal diabetes.
Okay.
Malway se tulig di bo reminder atara blue kumasing ngari tirgel tril military personnel el ngara quarantine mangari tirgel 21 el ngarsel bila patrol boat tirgel maldir ka ngara quarantine tirgel ngara marine law ngarse gidel patrol boat tal blel test tir elang se way algo account el 7 day test results tira tim le negative matamalamol mo Michael cancela quarantine to release tir atara lam larmeng sek masengar nya klolomra el ngara taiwang al may ra Thursday evening al mo Friday morning se ngar nya ngara haokol ma 60 plus el patients mar escort tir ma bebira essential workers el ngar se gidal me matuguk sa leme tamot mura quarantine so Friday nya ora mal mo to kara el ngara quarantine.
Okay.
So hindi kaya kita ko ra update sa COVID al sugumang jaka ko ra gerel say yung ala din kalmala questions mandi yung ilal interrupt nga ke ilo al ngarnya kalfi
ako man dirgo si siul area mlamos mera
sel abay mlakpas ra 80 Bumingi tulig si kamamtel di gamla akol nga mamutron ra atara ko mitamal ko ra matar basrir makatati malumol malulu tira kali di isa sa igidel el sit prep.
Okay, ya belaw lang agil ten el blue el COVID-19 free belaw di mo kurang ya dirgo ay say. Okay.
Tingaring yawan na ban watu am le report guys. Masay kita ko kamla mo dakal COVID free.
Marshall mangaryawan el case mangmlamo 9.
May
9 in ko di estimate 9 blue limle agim le 11 lam la moriat atura gigid 11 mlamo smera radringi mangwat na if our calculation is right, ting na atmosphere ito blood the region tangari. Let's keep our hopes. Say hey kita anadiwa say gide PIO o lease vaccine more available so the rest of media mula say more available sometimes before the end of this year. I'm very optimistic. Say we will be the first one to include Americans to get the vaccine.
Okay.
Okay.
Kaya nga talo mo state rep, ya mlamona iniwan na deaths sa Guam. So in the last 24 hours, yung mula niya Adelmas, well, blabol na iniwan.
Okay.
Kaya new cases in the last 24 hours, 181. Tamaral mata arbasiri adrakwa mabigyan de arbasiri tamaral di ngarang nungu aldirir.
Was tidak bar tokar ata same gire mo concern and gire tegi the COVID-19 ra wa man na tomliablu. Anyway, madar was just orang ko na marung ra mo masatyal topic re algo sel bantri tigal el tira professionals el bukura tora sa sugal tiang atara malum godal el draft el se vede preventer ngi assume ko mo on tirak la tele abnur ma lifestyle ki man
wala si mela mangyal ko tel mama mo da du toktang ko do lingi terngi mang mo mule.
Okay. Dr. Myra Adelbai-Fraser.
Okay, thank you. Good evening, Mr. Diaz.
Okay, good evening.
And happy Veterans Day to you and all your listeners.
Okay, thank you.
Okay, so long for this opportunity and happy World Diabetes Day this week. To our listeners, just to reintroduce again, I'm Dr. Myra Adelbai. I work at the Belao National Hospital specializing in internal medicine.
Okay.
Okay, so our topic today is a very good topic. It's just really brief, and I wanted to go over several interesting things that I've also encountered and myths that I do hear about at the clinic. And it would be a really good opportunity to also answer any questions if you may have any. Okay, so for today's content or for today's topics, we'll be defining diabetes. We will be discussing the different types of diabetes. We will also be discussing about risk factors that can lead to diabetes. And we will also be going over some signs and symptoms. How is diabetes diagnosed? We will be covering on complications and how do we treat diabetes. Okay, so diabetes is a chronic condition that occurs when your blood sugar is elevated or if it's too high. And this happens when your body doesn't produce enough insulin or your body is not responding to its own natural insulin. Insulin is a hormone that is produced by your own pancreas and is used to help process sugar in our body. The types of diabetes that we know of, generally the most common types that we see are type 1. This is when your body doesn't produce insulin on its own, and it's usually diagnosed with younger patients. We say that we see this in cases less than 40 years old, and on average, this actually occurs and is usually diagnosed between patients in the ages of 4 to 14 years old. Unfortunately, yes, as type 1, it's an autoimmune, so it means your body produces certain antibodies that attack its own pancreas, so insulin. And unfortunately, these are the types that you cannot reverse. Okay, so that's type 1, yeah? Type 2 diabetes is the most common type of diabetes, and it occurs mostly in not elderly, but older people, like over the age of 40. And this occurs when your blood sugar becomes elevated because you develop what we call insulin resistance. It means that your body is not able to effectively respond to your own insulin. This is lifestyle related, but the good news is there are ways to help prevent type 2 diabetes, and we will definitely go over some of those tips. And now the third one that I just wanted to bring up for discussion as well, or just to let you know, is that there's a type of diabetes for pregnant ladies, and this is called gestational diabetes. So interesting thing is what happens is the hormones during pregnancy causes a form of insulin resistance, so your body will not be able to regulate the sugar as it should.
And this type of diabetes, or called gestational diabetes, once after the pregnancy is done, then you can go back to normal. But very interesting thing though, and this is a risk factor for diabetes long term, is that 35 to 60% of patients who have gestational diabetes, they are at risk for developing chronic diabetes in 10 years. So these are a very special set of patients that we need to monitor even after they've delivered. Okay, that's interesting information I wanted to share. Okay, so moving on to risk factors for diabetes, because a lot of my patients, they usually ask about what are some of the risk factors, or what can we do to help prevent getting diabetes. And I always tell them that we work on our healthy lifestyle. So the modifiable risk factors, or the things that we can change, is number one, physical inactivity. I would highly encourage everybody who's listening to think about how often they exercise. And because I want to encourage everybody to incorporate regular activity and regular exercise into their lives. Because even if you are diagnosed with diabetes, this really helps prevent you from progressing. It helps create your body to be more sensitive to the medications and more sensitive to your own insulin. Okay, number two, we have to maintain our ideal body weight. Okay, number three is maintaining a healthy or normal blood pressure. Number four, high cholesterol. Other risk factors that we also know of that we cannot change much about, but it helps us determine that we need to screen for type 2 diabetes, is if you've had a family member with diabetes. So that's one risk factor. If you are over the age of 45, so that's when we can start screening for diabetes as well. If you have a race, we say race or ethnicity risk profile, because those who are Pacific Islanders like us, we are very high risk for developing type 2 diabetes. And also if you have a background of gestational diabetes, or if your mom had gestational diabetes, then you are also at risk. So these are a very good set of patients that we like to screen early. And I really want to emphasize on screening as well, because what we do know is that we can help reverse or control type 2 diabetes when we catch it early. Okay, so next question that I often get is signs and symptoms of diabetes. So when you have diabetes, it's very tricky because sometimes you don't have any signs and symptoms. But if you do, you can present with things like frequent urination, or you pee a lot. Number two, you can have excessive thirst. You're always thirsty because you're always peeing a lot. You have weight loss, unintentional weight loss. You have fatigue, you're feeling quite tired, low energy. You can have blurred vision, and you can have frequent skin infections and poor wound healing, which is actually very common. We see a lot of patients who present with chronic infections of the skin, and sometimes they have wounds that are not healing properly, and that indicates for us to start screening and think about diabetes as a possible diagnosis or cause for this. And it is unfortunate that some patients already present with some complications. We do get patients who come in with heart attack, stroke, or kidney failure, and when we do screen, they end up having undiagnosed diabetes. And again, this is why I keep emphasizing it is very, very important that if you have risk factors, or if you have any signs and symptoms that I've mentioned, come in and get screened. Okay. So when you come for screening, this is what's going to happen. Your doctor or your nurse will most likely do a blood test. And this blood test will help us determine whether or not you have diabetes. So what we look for is what we call an elevated fasting blood glucose. So fasting means no food or drinks for 8 to 10 hours. And if it's higher than 126 milligrams per deciliter, or if it's higher than 126, that's the unit that we use, then we can say you most likely have diabetes. But here's another thing that's really important. Even though you have an elevated blood sugar, we still need to screen again. So meaning to say we will double check you before we say kamral sukal. Okay, so test number 2 that we have available is called an HbA1c. So HbA1c is basically a percentage of the average sugar reading over the last 3 months, and it comes in a percentage range. So if you have an HbA1c of more than 6.5%, then we say you're already diagnosed diabetes. And again, if you present with this for the first time, we will definitely be talking about some of the causes, and then we can also reassess and determine if this is confirmed as well before we start on treatment. So that's the second test. And the third test is if you have what we call an elevated random blood sugar, meaning to say we check your sugar at any time of the day, and if it's equal or more than 200 milligrams per deciliter. If it's more than 200, then it most likely means that you're diabetic. So then we need to really look into it and confirm that you are by repeating some of these tests after some time. So to summarize for the diagnosis, if you have a fasting blood sugar of more than 126, or if you have an HbA1c or the average percent of your sugar reading in the last 3 months is more than 6.5%, or if your random blood sugar is more than 200 milligrams per deciliter, then this may indicate that you have diabetes. And this would also indicate for us to help with confirming this diagnosis. Okay. Now, the next topic, or the next slide that I have here is complications of diabetes. It has been very unfortunate that we see a lot of patients with cardiovascular disease such as stroke and a heart attack secondary to diabetes, because diabetes affects the blood vessels, and when you have blood vessel disease, you have a higher risk of having lesser blood flow to essential parts of your body, such as your brain and your heart. The other common complication that we unfortunately do see as a result of diabetes is chronic kidney disease or end-stage renal disease. And this is when, at its most severe form, we put patients on hemodialysis. Another complication that we see that's quite common as well is lower extremity or your foot, or the foot gets infected, and unfortunately, in its very severe form, leads to amputation. And when we do lower extremity amputation, it's very, very challenging because it will lead to disability. It's very hard to see a working person who is the breadwinner of their family with this sort of disease, because it will affect it will affect their lives, and it will affect their work. And it's been unfortunate that we do see patients suffering from these complications. A complication that I also see quite often in the clinic is complaints of pins and needles or pain, and this is something that we see with nerve damage. So I remember my consultant told me that, the sugar, diabetes is not only a problem in the blood, but it's a problem everywhere. It affects your vessels, it affects your nerves. So this is what we call diabetic neuropathy. And for some of our patients, there are some ways that we can help manage this. We advise everybody to keep their blood sugars controlled so that we prevent progression. And then we can also give some supplements like vitamin D. Okay, and then I do want to really, really emphasize that all of these unfortunate complications are preventable. All we have to do is work together to control our blood sugars. Once we're diagnosed with diabetes, we have to just keep the sugars controlled so we don't have these complications. Okay, and then now for the next part, how is diabetes treated? So diabetes treatment is like a marriage. There's always partners to this. Healthy lifestyle and medication. So those are the two most important things that I really, really wanted to emphasize. the medication can only work so much if you maintain a healthy lifestyle. A healthy lifestyle includes having a healthy, balanced diet, regular physical activity or exercise, not smoking, and not chewing betel nut with tobacco, maintaining a healthy body weight as well. Okay, so for medications, I've been very lucky because we have good medication, and based on our guidelines, we have tablets called metformin. This is usually a medication that we start off new patients with because it helps increase their body's responsiveness to its own insulin. That's number one. Number two, we have a class of drug that we call sulfonylureas. And an example for this, which I think some of our patients who are listening will know, is glyburide. This kind of helps control the sugar levels, and it works very well, especially with metformin. So there are some cases where you start with one. There are some cases that you might need two medications. And then we have new medication as well that we call sitagliptin, which does the same sort of, it works by lowering your blood sugar. And we also have insulin available. So a lot of my patients, they always ask me, Doctor, if I start taking these medications, am I going to develop resistance and I'll end up using insulin? And I always tell them that that's not right. What this means is we want to keep your sugars controlled and you want to keep your weight controlled. You want to stop eating unhealthy foods so that we don't progress to a stage of diabetes that you'll need insulin. Okay, there's always a way to prevent it. And like I said, it's just from the beginning, as soon as you know where you're at, if you're pre-diabetes or if you are at risk or if you are diabetic, the trick is just by working close with your doctor, taking the right medication, and maintaining a healthy lifestyle so it doesn't progress into complications. Okay, I feel like, okay, so I hope this is I hope I've been sort of, everybody's listening, because the last slide is actually a quiz that I wanted to ask. So, Mr. Diaz, if it's okay, I'm going to ask you a couple of questions.
Go ahead.
And, yeah, and this is going to be true or false. Mm-hmm. Are you ready?
Ready.
Okay, cool. So, question number one. Is diabetes reversible? What do you think?
Yes. I say
correct,
yes.
Excellent. So, absolutely, diabetes can be reversed if it's catched early. And this is what we call pre-diabetes. So, as mentioned before, if you're overweight, if you have maybe a family background of diabetes, if you may have a mom with history of diabetes during pregnancy, or if you yourself may have gestational diabetes, then you are one of those patients that we do really want to catch early by doing screening. Mm-hmm. And if we can catch you in an early phase, you can actually prevent yourself from going into diabetes. Once you are diagnosed, though, in an advanced stage, it doesn't mean that you have no hope. It just means we will work together with treatment, we'll work together with lifestyle changes so that you don't end up with complications and you can live a very long and fruitful and productive life. Mm-hmm. Okay, thank you.
Okay.
So question number two.
Oh, go ahead.
Yeah, I know. I have a lot of really interesting questions. So I mean, that I wanted to kind of like test.
You should have told me so I prepare myself for this test.
I know you're good. That's why I kind of wanted to,
ask me hard questions. Yeah.
Can I answer? Oh, possible can answer. Actually, we can. Let me give this to Adam, and then she can answer. Since he volunteered. Okay. So, Adam, here's my next question to you, my friend. My mom and my dad have diabetes. Am I going to get diabetes?
You're at risk.
Thank you for answering. Sulang answer say that's a very, very excellent answer. And yes, so I will say false because you are at risk, but true, you can prevent yourself from having diabetes. So even with a family history of diabetes, you have the power to prevent diabetes from developing. And this is a very important thing, is to get screened early before the age of 40, adhering to a healthy lifestyle and avoiding unhealthy processed foods and staying healthy by exercising and maintaining a healthy weight.
Okay.
Cool. Okay. One last. This is going to be the last question, I promise. Okay. Medications for diabetes will cause liver and kidney failure. True or false? It's a trick question, I think. What do you think?
Edom must answer that.
Edom, over to you, Edom. What do you think about this last statement?
I think false.
Good. Actually, it's correct. Thank you. All right. So thank you. So a lot of people have great concerns about medications causing liver and kidney failure. But I just want to verify that according to the studies, what we know is your risk of liver and kidney failure with the proper treatment is very low. As compared to the risk of organ failure because of uncontrolled diabetes. So I do get a lot of patients who stop taking medication or who refuse because of a lot of worries and concerns. And I understand where this is coming from because, for many years we have been hearing that, sometimes taking medication can cause kidney and liver failure. But actually, the association is sometimes patients have a very uncontrolled diabetes and they end up having these complications rather than them taking the medication, if that makes any sense. But I do want to encourage that this is always an open conversation that you need to talk with your doctor, with your primary care physician, so that you can feel comfortable with your medications. And I'm very open to questions, so if you come and see me in the clinic, you can always ask this kind of questions.
All right.
Yeah, so I guess that was probably the last part of my discussion, and I hope that helped a little bit.
Yeah, well, I just took my annual physical yesterday at Dr. Yanu's clinic.
Excellent.
Yeah, and everything is okay except that my sugar level is up a little bit. It's nothing to worry about, but he told me he said, instead of 3 meals a day, Diaz, you're going to have to cut down to 1 meal a day. And then you're going to lose some weight because you're overweight in a sense. So if you do that, your blood sugar come down. But you know what? I've been taking Ongail, Dalalakal. I've been every morning for the last 3 years, I guess. And I'm just turned 71 years old last Thursday, November 5th. And the cholesterol is also up. Because I eat a lot of high cholesterol food. And if I can control that, and since the election came around, then I don't really do a lot of exercise, going fishing. I more like spend my time talking and do a talk show and stuff like that. So no physical exercise. And so I know, or I feel like I know where I failed. So now I started yesterday. I picked up my, daily routine, and that include exercise. I go out there and sweat, by doing something physical, and then at night when I take a shower and go to sleep, because I don't eat at night. 2 nights ago I stopped eating, and I feel much better. Anyway, I don't have any kind of a disease. It's off now, unless I just don't do anything to prevent myself of getting my sugar level up. If it goes up, then that's trouble. But right now, so far so good. So thank you.
Thank you, and congratulations. I really appreciate that the first step is to get yourself screened, and the second is acknowledging where you can improve. And I really, really wanted to say thank you for being an excellent example to all of our patients.
Right. I think, if we follow this simple rule of thumb, like when you go over 40, you gotta go and see a doctor like every 6 months. Okay, and then you go 50, you go like every quarter. And then if you go 60 and up, it's nice if you can go every other month, and have your blood checked and everything else. So if you catch if something is wrong with your body, then and you catch it earlier, there's a much better chance of cure a patient. But if you wait until you become real sick, then I think that's not good for anybody.
Waise tulig ang ngariya question ng let mo doktang di along the lines sa yen bukal blal tua tulig at masay sel obo mo dinge masay ngariya ko ra itu traba dinge malubeng smera dinge may say gidel mobile oil mo mesra doktang so dimle so kallo ay se doktang at masay kidimle o mesra sel teira base rigid lo sob amalo to da yen buk o ur tirgel adal sugal mera osong al ramiu tal NCD clinic al ngari ra OPD megal dispensary so sel domicile ni tulige tirgel adal oil al may magim le wa yagi mo besara district maset tangara tirgel patients el one visit tira in the last 12 months ngara tirgel patients tabetelar patients el 2 or more visits al mera ra al sela last 12 months so sel domicile ni tirgel oil al may regular visit tira el may o mesra dokta ngari ya hora no tek mase oit mo melansa mo control away tir ma medication tira ta compliance sel domicile tira yegi de lo ura wa lo lutul mase control da su golingir so tamase sel me ata tu tir man dokta ni el bornya hu problem na carrera et tu ka discuss change so sel domicile yegi de lo ura average el HbA1c se yegi de lo bornya dokta a control da ngario so say da utim le so al mention ni dokta nga question net mo I guess masader sel masing tel makasakla but ngem sel obom sukal sel bom when you become diabetic what is it that's happening to your body so maraming maybe sa MLO spare example ro obesity like the all mo atak masing exercise se bom ngilo more malaka bom ko dalbulen sa ML mo sukal so sa ML ko ati explain say give el kora rational masing makasakla tel but ngem le kaul mo ko dalbu
okay so sel obesity or overweight it really has a big impairment on the way that your body metabolizes sugar from the levels of the tissue. And exercising actually helps create your body so that in a way more sensitive to insulin. So it's like a cycle. It helps regulate actually your own body's mechanism. And also if you're taking medication and you continue to exercise to do weight reduction, it helps especially if you're taking insulin. Yeah, so it helps with your own insulin, and it also helps if you're taking synthetic insulin as medications. And I think it's all about, it's a very complex pathophysiology involved. But what I always tell patients is weight control. Just to summarize, weight control definitely will just create your body increases your body's sensitivity to the way that the insulin should be working, if that makes sense.
A function ra insulin control da sugalingin.
Why say insulin is the one that regulates asukal and the way that your body processes asukal. So type 2 is like when your body is kind of not processing the hormones as it should. So exercise definitely helps with that.
Okay, I got a couple questions came in and also just a comment. Here's the first one. It said, why are we Micronesians are prone to diabetes? Dr. Myra Adelbai.
Right. So the studies do show a lot of Pacific Islanders with an increased risk of diabetes. There are several mechanisms for this. So I would say it's not just necessarily genetic. You can also say it has something to do with like the food distribution, like the way that we eat. Because I feel like there is a trend for us to go towards westernized diets. We tend to eat more of processed lokal, barasa. And we all know that the more that you eat these processed foods, then the more that you have a risk of having diabetes. And some would say that in some areas, it could be socioeconomic. Like, let's say, if you are in a place that you are prone to having typhoons, then how well do you have your crops there? How well do you have your food, the food sources? And this is also, it goes to a higher level because we're thinking about things like food security, climate change. These are also possible risks apart from our own, our bodies There's actually really interesting studies that say that Pacific Islands may have a certain gene for obesity, right? And that is always linked to processing sugar and insulin in our body. Okay. I hope that makes sense.
All right, here's the next comment from Arvin Raymond. Wase maral togo etulika President-elect Biden akman le mention raigal pelwat ra Pacific el kirela COVID-19. Kada noon na pelul adre lang agita President-elect Biden el man le mention el wase apelaw atar tirgel California COVID-19. Etidan mutlimong amlara Joyla King. Happy Veterans Day. Yeah, Happy Veterans Day, Diaz. Happy Veterans Day, Mr. Diaz, and all who served the armed forces. Thank you all. Thank you for your service. That's for you, all of us. Okay, agigita ko natin muli comment. El dirigam let mo. Esola Tolomon. Back to you.
Kamsulang tuling mela tiragi del perul dur sel ngaitia akora mombra amatokora brigel matokor bela le tiragal dur sa radila fiji tanga other bela. So it's open ended if you want, but this Saturday, World Diabetes Day, the theme is nurses. The nurses' role is diabetes prevention and management. So if you would like to make a comment, both of you, one can go first, and then the other, any comment that you would like to make in terms of nurses' role, malubing sel kukora sa bilgut maklil ya sel torbingi maluba atal kuprapol sugaling kukrolela kuruleni.
Halip pa po. Ako nga ka Marciana Ngirailemesang nga ka nur simle makatakatalo jura ital clinical tal level yu nga nyala. Mangora ti so kal sira kora example sensu kumas ramen yu ying lengtung sindel other belaw tiaka malungin medical term kidel tor belaw maklolos pa example masaw dalwase abatenge mang makarang mo kabasukal mga kaplolos pero wase ya letsetjal batenge aikal ngarte maletsia angur dadi wayara ila ya ikel blood cells ra batenge adi waya sidosia matjal sidosia maraina tolke da vitamins tolke da ki de carbohydrate tolke da ikel kal aikal nutrition miguel tipera batenge Michael Milisi angur temat elabenge mai wasem mai terokui edo silta mendere klol ngak taigel ngal marahin melas ngak do example rangur da rail ma mlail blood cells melas lo rail e gaudi all di mga marcos malube kam malga dalabo el aikal sugal rabningam do sing glucose sel mo nga marcos sel mo mablal abatenge melbla los pe aikel gire aikel restam ara aikal batenge melbla sing lao makal takatela tay metal lao adi maral lok trak metal lok trak de gasel sara batenge mel lo tur tiya gide sukan yang masta telgu mas artial torak armur trar sem sei ida usil chakar sem ya sukulnya mangarba leng diga batenge mel tukur mang armur tial al selam ursa
Sabi del mulu ase asukal al bolo bangkelars momultel tas
Kora dia kalsal mting bay maklot elel tomelamur
Oh
Paul mang moy sem elak mutus modikiran mo kora ikam temo understand melak tel sul blood cells sel lorail el abol al cloa sugal mal padur trasem etayid el blood cells cellul takaigal marail ikal nutrients al marail cellul tak endir dengya sugal cells dia ka mal cells ra ay kagidele eyo mandia kal sabi alangur dari per mapring mangarang may kalngur dati maral mol am sangada
I see
ya cellura masigi dia ulang way sengur lang ulma kidini mal sula madam kamo makito sangem Michael Endarawa, Klamgel Oi, Michael ya mo kora affected, leng malimisin magyakarel ngurda mang magyakarel hindi maldi mo kakarel ayo mo among tengkay makmat mandi waya kidni kaul el atyal el platsel sa selora el aragi dini impong lomi alwase ngaramo liokol mga ramadel esel labong etyal platsel sa di muyel sugal e dia ka ayo lola mangkal kidni gal ngerde la direct al molma len dia kala plongur mang madei masel la madei ende ya sip elung lodeyor Michael Lulio Korkaul wa excess fluid cycle batange malral ma motiak lo spe ma yagi dele ege Lulio la le sel ndiwa masil seng remur tamsil la mala oil ngin ding moni ege oil la madu la ke yalo ngirel mo oit mal di waya ke ni kaw masel su ko mo amangomi lomi lenga mring lo reol leng ayal sukal selur telmo in bulgola say guldi marang multago kilselil fisel enya sabe el lorior el remul yal sal mo boto endir ka murura tedo enya marma bebil mandi waisei ayal sukal adimran mo boto kol ba o tita eyo mang maring lorior e ka inafal galen mang mata kidini masel ba alma yaral mam akhir al sela badngem maulio kala mesegi denya satel mal matamala al sulam zam lekel murdam amake kare ilti mingi lakal dia mangmol made maklam ngel oim maikal oim le kausen le sel do or ya yel fluid mangara badnge tamir oim mai ke girel mutan me al sabadnge til sugum tial platsel sa di mese katra sugal en magaray ongak tawliyo ko loto del dize tegi da wadi simple so de la wasi ngara masugal lakto malang re ngara matamal lagi ni kaw ngara kamu almost ngara kamu ubiyo so I hope ang tigel ko tial sal mlgo to kamrigel amo sibil ko understand matumam nanglisel lul tutule la wasi ngara ulman toktang waseng gire malmalbod bra o mangal londraw lamamar ko sa rapatengem leng ore ding apatange amla modia kalsalung ilorior leng palblep to kay kay mangwal ko amla skare magati malmol malay lo malangal molmong matamalaw pebil or kalsara patingem nasi kamran sulang lang dia question sa biloke
dia kumada horas ma del malmo clear okay magadol mol ya yele imorano sengartilang tulgo to koram rigel mortigel audience sergir el dia hansal ngadia program ragmi usay gidel silsra tel dula seng world diabetes day ngadia kora tentol sera pringi de gomala se de chegamra ramara git
el al raje tuli ke mral moda kal sabab legi ko ramal santial covid man tegi del toksol git tegi da gi por account tringi activity ra world diabetes day diga mringe ya alastir mo blot ora tentora ermul parga man ata sabil huk mustafa di el algira gi ko ramal meringa tera covid ma ora ta kal sal suat del mingid baramal betokol ado manguka bloda we couldn't have the usual health fair ma wakaton so hopefully next year hopefully.
Did you have stop rather was say for hospital and have simple mas simple la nga ka computerized la kakmalo mes sa klinika doctoriano tamal dingwar sa ul morala be mergo find out was say ka prostate tasugal ka wala mang tadingwa sa mergo kamrale mo set regal be mesra tok tangeng mo tong okle mo ge rogul daira information ng atyal report to the computer based rigel piles lo ka a blood test
mo se tuli gamang maring lesel aga ko tel gora tiril metal hospital en bol meser magi ngari trial ko bebira at mamra community health center mar other nurse ma rubior NCD trial kita ay lagi ko ramlal mustal malasam mo masmok lagi gitu ludio rakensa ma mga dadul mo raboy matirige ko ka eli etamlo rai tukuplo ngari ang activity til morsel ira elementary school matukuk ka malaya blood pressure at ngaringa babier legel ulgo toktang alpase ngaringa igelo modong non modifiable risk factors al toger ti so toger kak maset telarkim kau ngaringa adam smera sugal ngaringa tap dio levom sera sugal kau ba exercise so ay gigit questions al bal ko teloger nyeng meski da score kora diabetes masih kau ngarate elem mo sugal el suko mangaraba betore kami detik masih malungi la over hospital malugi ko mora community health center etcha sugalengin so say kida loru ringi mang ay kida usab edending ndia ka other hospital el mustobra other material for the annual checkups or just come mo gere brilla appointment kal mo mala sugalengin manala be po mo bisan dokta so say maldi open el morangi dil adra rawa blue belaw
tiagid os nga kara ngal kara school nga minsera kuk tema magekare maral me klo sola aki ipya bang ko liaye del mong marangi rasar maso se kora digi panle active mang dimlakim kora armesa ka gidel teletar rat del mosadre la time akul go il to asi mal betok ngal kara elementary school ako mesetir mal overweight ngwangara ngaringa bagare ngal tat ngara say the age level it was at ngara elementary school 6th 7th grade age group pero lang el smer mal ubet at risk because await tira mal ngarba.
Yeah, we do have some younger patients and newly diagnosed with sugal, and the prominent risk was family history. And also obesity, yes.
And my lifestyle tira ngadia nga kanya algegal madim lege gare mergo moria mos me aki mun mo type 2 diabetic ka diabetes maki nirun mo attention at dokta elang si to in okay.
That's very good to hear.
Okay, kadol mon engel imora nurse elang kuklong do atokora amrigel mitigel audience gide dia lo tokor pela o sivire.
Thank you, Dr. Diaz. Good evening to you and happy Veterans Day.
Okay, thank you.
I'm Nurse Karol, who used to work in Peleliu.
Okay.
Before I went home and took Doctor home, and he passed on. And I was blessed to be called back to Belau to work, which I feel this is my second home now.
Oh, I see. Welcome.
Anyway, it's World Diabetes Day, and the theme that we are looking at is nurses and diabetes. Nurses make a difference. It's a very important theme when it comes to us as nurses to play a role in supporting people living with diabetes. As statistics show, 59% of the health professionals are nurses. So we can see that they play an important role in diabetes treatment and management. And as we can see in Belau, all the nurses are in the health centers who are actually work with the doctors every month, screening and managing the patients every month. So their role is very important in the sense that they're actually working in the health center sometimes with our doctors, and they are the first people that come in contact with our communities. So as we have heard from Dr. Myra and Along, the health center is available, and when the communities have access to the health facility, that should be so much easier for them to come in and ask for just a simple sugar test to check on their level of sugar, and the other important thing is just through my experience working in the health centers for the last 6 years here in Belau, one area that we used to encounter from patients is they did not come in for their follow-ups, even though they were called. So at this time, I would like to encourage the community to make use of the services that is brought closer to
to the villages or to the health centers that they are being looked after. And the nurses are always there. So as we can see, the theme is emphasizing the role of the nurses, because we are the first healthcare workers or frontline workers that are most working closely, mostly with the community. Yeah, they are there to assist the public. They are there to help them, just through advice and counseling, to prevent these complications that Dr. Myra is highlighting, where, we don't want all our diabetic patients to reach. So it is important that the public appreciates the nurses that are there and their services and make use of them while they are there to come in and seek help. Okay. Apart from that, I also feel that it's healthcare services and the government should be able to recognize the importance of the role of the nurses. Maybe invest in their education and training. I would say back home, diabetes is such an important area of health that they have a diabetic clinic and they have a nurse educator who actually is just in charge of the clinic, the running of the clinic. So maybe in future, we hope the health ministry will look into that. Because of the fact that our population is really affected with this disease, come COVID-19, we are in such a high risk. And again, I would like to emphasize, just to add on to Dr. Myra's presentation this evening about the value of the local food. It's so important, even though she said that we have we are a high-risk group of people, but I still feel our local foods are so much healthier than processed foods. So that's probably one area that we need to really emphasize and talk about as communities. Apart from that, we are here to answer any questions, and that is all from me. And thank you again, Mr. Diaz, for giving us the opportunity to come in and talk about diabetes.
Yeah, thank you so much. I strongly believe that your lifestyle, see, like where you come from, I've been to Fiji, and the central market, is right down there by the water, and you have so much fish and also taro and vegetables, and right there, it's a one stop where you can go and buy a lot of local food. But I agree with you. The fact that is our local food, our food are much better because there's no additives, and there's also no preservative, which is the food that we import from outside of Palau to Palau. The way we look at things now is that we all too busy. It takes mom and papa to go and work to bring money home, and when they get home, they don't have really time to cook for the family. So what they do, they just reach out for canned food and other things, which is already contaminated with preservative and additives, and it's really not good for us. I totally agree with you.
Thank you.
Okay, back to you. Karol.
Sulang itulir. Hindi ako to ara endra program regi de qadir ka halmu te question el metmu. Mangla sab edel tu mangarya koralas tal comment sertiral gestergi el volbrege dong simere.
Okay.
Actually, I just wanted to say, once again, thank you so much for your time. And this would be a very good time also for me to relay a good message and encourage on a different topic or note, just to encourage our young listeners to consider having a career in healthcare profession, and I'm just sharing this from experience because as a youngish doctor, I see a great need. Like these are young interns who are very enthusiastic. They graduated from Cuba, and I see a lot of potential for young. Like we want to see local physicians as well because. In this way, we give back to our communities. We sort of like, it's just a way it's a good opportunity. And I hope that in the future we'll see more young doctors joining us as well as nurses and other healthcare professions. So yeah, thank you for this tonight. I really had a lot of fun talking with you and happy Veterans Day once again to everyone.
Okay, thank you so much.
Ngoise tulik di tirakal terul nurs dokada kal promoter kal nurs maka ne pramisra ngel kuk director nursing masak mal mo promoter nursing so man ikan dilung Dr. Adelbai mal lungi lendi amati de kalmal lol nitra biya kal adra belur mase del kal nursa hotel tara ayel mal dolingit kasi olgo maraba mo nurse lesmera selvolom sa toktanging di mesang what you consultant 20 minutes stops 20
depends on the consultation.
Isele ko lo misra ko.
15 at the most.
15 to 20 minutes. Hindi 15 to 20 minutes sa temelo. Hindi nurse ang yalo ko teklo temelo misra kalsme mga tatuuringi. Hindi unfortunately tinakal nurse kita ko tilmasang almalaya bla tsaka viral sebeto kaloru lamang modak segi del ko rawan anwan ma okmong segi del ko nya Karol kasi ngari nurse educators sul uktingar alira mga tatuurar sme kalubar nurse sa mo nya te alira luk ngar segi malungil makamalol gitar ngalgarabluk mase gimalol gitam please su mga te aliwe bom nurse katamalok spare nurse mandi kay kide tuli ke a question aring plol ngari question matel question ra el sales gira la diabetes makpak mo asker ngiru era to masum sel last question adim la ka adal answer ngi hala ko otta answer ngi leng ang mlarnya ruger mang sel mle question ak masay mrigel ya ku generic sa akora wayal determine raklawan di belaw ngara sel ko ramal lang alelak mo ko kawan ma evgeu Juan Anastasio di luluasi sel ko rawaya lolang malupe mo otak klaw other belaw areng sel rungula adal mo raktaraat so sayit sel ko question na last week ma answer ni ya question el kapsinge yak masay ngara nga kalbe ngara three risk factors ra diabetes so sab illegal modifiable malubeng non-modifiable ayel OBL ng rulaw mo klote element mo sukal mayel kuk niya lifestyle related ang tetelela klangar rakaweng ang siya te element mo sukal so aki di aska 3 mansire roller say gidal dengwal 775 1138 malubeng 488 4601 ding ay gidal mo after a show mansiya kal insira dengwa
what's say okay ko pa miskular rogoy have a nice weekend okay
Mada halati gibalo nga sule metuli ma Eco Paradise ma del other listeners mahuk next week. Tirakal gestri.
Okay, sulang eme ikaro ko.
Okay, kung sulang. Sulang.
Okay, bye-bye. Well, seguidamlo mereka programa Ministry of Health ma EOC ko mal masaul ngatelo Mr. Miro ko imle post a question malube como aiser ko mal wasay como ranks malube como Mr. Tel program and tianga ka programa Ministry of Health sera way back in March at kim start ringi mergo maptera ki moru ringi min merelang solai tel Ngirar udah remains luasnya apelawa timuk raikil 9 different country ngarianan pelura terjadi karbon COVID-19 apelawa timuk rengi soalnya mati suatu mereka subira rukul tidak umrah artian Ministry of Health ma director EOC Sola tolmol mo bakitaring poto support trabes el presidente Git el kuknamit surang al whips junior electe sola tirgagidrelal mga makortir elang el mo asay malas mal organize ra apply ra senate ma house Umbral Segidrurior, and other than that, Palau is in the good hands. I want to take this opportunity and thank the United States Ambassador here in Palau for allowing B-1 bomber with 2 F-22 jet that flew over Palau during the Veterans celebration of the Veterans Day here in Palau. We thank the United States and all the supporters for this occasion. This is Alfonso Diaz saying, have a nice day. May God bless you all. Bye-bye now.